John Lobb, National Institute of Justice. Over the last 25 years, we've learned a lot about differences in health with respect to gender, with respect to race. We know there are huge differences with respect to suicide. And I'm just curious if any of the panelists can tell us, what do we know about differences with respect to officer safety with regard to females or African American officers or Hispanic officers?
Well, I can tell you that from our health research that female officers have a higher rate of depression than do male officers. We found that in our last sample. They also have a higher rate of PTSD. They have more problems, and this is kind of interesting, that they have more problems working a day shift than they do an evening shift or a night shift. And I think a lot of that has to do with probably with family care is one of the things. And the second thing is they're more exposed to the environment of a male-dominated occupation during the day than they are on midnight shift. So we are seeing higher rates of depression in women on the day shift. And it was kind of an interesting finding. The risk for cardiovascular disease also seems to be higher in terms of artery health among women. What we do essentially is to measure the ability of arteries to expand, and when your artery is not properly working, it won't expand as well as an artery it does. And we're finding in women that they have less of an artery expansion when we measure it with ultrasound. So there are signs of subclinical cardiovascular disease in women that right now in our sample are greater than men.
That's an interesting observation and our conclusion, because most of my experience has been, particularly when you talk about deadly encounters, and one thing that we want to do is to avoid those that you talked about. And what at least my experience tells me is that for whatever reason, females are more apt to use those communication skills better than males are and able to avoid those circumstances. Can you speak to that in terms of how that perhaps or does not play a role in terms of their propensity or lack thereof of committing suicide or being more effective or less effective in shooting situations?
Well, yeah, I'm not sure how it would affect shooting situations, but I think, overall, in general, the experience of policing for women, I think, is much more difficult than males. And I agree with you, they are better in talking down people, I think, without using firearms than they are than male officers. I think male officers react more quickly to situations. But I don't know what the connection is between that. I think in general, though, their general exposure in this sort of occupation puts more stress on them because of gender than it does to males.
Okay. And Police Foundation research done on women in policing a number of years ago supports your intuitive experience that women do a better job in interpersonal communications and therefore are less inclined to need to use deadly force or physical force.
There may be another factor there too, because you're reporting, and I think from what I've heard also in the folklore, that it's true, there's more stress for women. Again, military, same experience. There are more stressors, and they report more depression, and they report more PTSD, partly because they're more willing to report. But I think there may be a self-selection issue there. Well, these women are obviously, they've got more of these problems, and they've got a lower suicide rate. So there is a difference in resilience there. And I suspect it may be just that only the most resilient women go into that line of work.
Well, just going back to the CDC data for a moment, in terms of female suicides, we're seeing an increase in those as well. And as the number of women, I think about 10 to 15% are women in policing now. As we're seeing the increase in women in police officers, we're seeing an increase in suicide over that 15-year period. And I see that trend increasing. And I think a lot has to do with the amount of chronic stress that they have that maybe males do not have to deal with.
Well, and there's still cultural issues in police organizations for women, so a lot of those cultural pressures have an impact on their ability to adapt and adjust.